Dr. Travis Gratton with University Veterinary Care Center is joining us live for our weekly pet advice segment. And this morning, we're talking about cryosurgery. Good morning, Dr. Gratton.
Good morning, Erin.
Well, let's just start with what is cryosurgery?
Cryosurgery, in essence, is using extremely cold liquids or gases in order to remove tissue or unwanted tissue. So fairly common on the human side, especially with dermatologists. A lot of people have had various things frozen off of heads, shoulders, necks, backs, wherever.
Well, for animals, what can this type of surgery be used for?
Well, largely we're looking at benign tumors. We're going to, for a lot of dogs, especially as they age, we'll get little skin masses. So skin tags are really common, especially in certain parts of the body. The adenomas or little wart-like tumors that form, and then various other benign growths as well can all be removed pretty easily with cryosurgery.
We're seeing some video right now that you provided of cryosurgery, so kind of explain how it works.
Yeah, it's pretty simple in that with kind of the pinpoint applicator there, we're freezing or applying a gas, in this case it's the nitrous oxide, directly onto the surface of the tissue. Since our cells are 90% water, that water freezes, forms ice crystals. As it does, it expands and it disrupts the cells and the structures within the cells. So then over the next week to two, those cells die. They will eventually kind of slough off, be replaced by a little scab, and it'll heal across with generally almost no scarring.
Is it painful?
Generally not. Most of these structures don't have nerve endings associated with them. If you actually get it on your skin, it does create a little bit of a tingle, or you'll get a little bit of a twitch if you get down into normal tissue. But the beauty of it is that we're able to take often multiple little lumps off of animals without using any sedation or anesthesia. They basically will sit there on the exam table, and we can take these off, and it's relatively simple, straightforward, and not as involved as actual surgery. Any
disadvantages?
Well, disadvantages, certainly there are a few places we can't do those on safely, like eyelid tumors. We can't be pointing it near the eye, sometimes in the oral cavity, just places where we have difficulty accessing. Sometimes on the face of animals who are really nervous and just won't hold still, may require some sedation in order to get the cooperation to do it safely. The only other big disadvantages, and why we say it's for benign structures, is that it destroys the tissue, so we don't have something for biopsy as opposed to a surgical biopsy. So if we suspect that it's a malignant type of cancer, we're going to probably want to take a biopsy, take those off surgically or with punch biopsy or something like that to send those off and see exactly what they are.
All right, Dr. Gratton, thank you for being with us today. And for more information about University Veterinary Care Center, just head over to universityvetcare.com.